All right, welcome back. Periods can bring all sorts of discomfort and stress, particularly when they're irregular.
Well, our next guest is here to talk about the #1 cause of irregular periods. It's a condition known as Polycystic Ovary Syndrome, or PCOS, which impacts 7 to 10% of women globally. So please welcome to the show OBGYN and founder of Anova Fertility and Reproductive Health, Dr. Marjorie Dixon.
Welcome. Dr. Good to be here. For having me.
Can you let's start off with the basics here. What is PCOS and how does it cause the irregular periods?
So PCOS, I call it an incredible chameleon because it masquerades as a lot of different things. However, there's a hormonal dysregulation in the communication between your higher brain centers that are sending the messages to your ovaries, as we all sit, to ovulate every month. And because it's dysregulated, you don't ovulate. When you don't ovulate, you don't get a period.
Wow. I know, we're all just like, wow. All right, so who can this affect and how long can they be affected for?
So it can affect anyone that's born with ovaries and any time after your first period and then throughout your reproductive lifespan, so into the post-menopause.
Okay.
Okay, so there's a lot of like miscommunication happening for a very, very long time.
Yes.
I want to talk about diagnosis for a second because you say in 2023 there was new criteria that came out for how PCOS is defined, how it's diagnosed. So tell us now, what is the updated criteria?
So you need to have 2 out of 3 criterion of the following. So the #1 is irregular periods, so irregular menses, #1. The second one is high androgens, that's male hormones. So every woman actually has male hormones, but you have higher than normal in your bloodstream, and sometimes it manifests. Then the third thing is having polycystic appearing ovaries. So that means that your ovaries, because you're not ovulating, you're sort of hoarding eggs, and they have a very typical appearance on ultrasound. So you have a lot of peripheral cysts because the eggs aren't coming out of the ovaries.
Too full.
Yeah. So you need 2 out of 3 of those to have a proper diagnosis.
Why 2 out of the 3?
Because it needs to be diagnosed specifically. You want to have the specificity of a proper diagnosis because remember I said it's a crazy chameleon. And any one of those things in and of themselves can be other things.
Right.
So you said the #1 reason we're having irregular periods is PCOS, but other things can mean that you're not getting your period. So you might not get your period because you're stressed in an exam period at school, for example. Or you might have high levels of male circulating hormones and have hair on your face for other reasons, right? So you have 2 out of 3, it improves the specificity of the diagnosis.
Okay.
Let's talk about fertility because I would imagine if you're having dysregulation in ovulation, fertility might be affected as well. So are those who have PCOS, are they having fertility issues too?
Okay, so this is probably my pet peeve. The patients come to me super anxious. They're always told, you will not be able to get pregnant because you have PCO. That is not necessarily true. So you can need to see someone like me, a fertility specialist, in order to time when you're supposed to have sex, because if you don't know when the eggs are coming out, the sperm can't hit the targets, can't make a baby, okay?
Right.
So you might need to see a fertility specialist, but you won't necessarily have trouble getting pregnant.
And so presumably if you have PCOS and you don't want to get pregnant, you should still be using birth control.
1,000,000,000%.
Right.
Yeah.
A 1,000,000,000%, because I see people who are like, doctor, I need to see you, I get referral for PCOS, and you see the patient and whoops, they're pregnant, like 14 weeks.
Okay. Very good information. All right, so we're talking about periods and fertility, but you say there's so much more to consider when it comes to PCOS. What are those other things that we should consider?
So especially, this is the new guidelines came out, so you do have to have 2 out of 3, but there are considerations over your lifetime. So first, you have your missed and irregular periods. You have hair growth, so signs of, we call it virilization or hirsutism. So, you know, women can have male pattern hair loss or acne on your face, back acne, hair around your nipples and your lower abdomen. Those are signs of high androgens. You can also, because it's a lot to deal with, irregular periods and the hairiness, a lot of women with PCOS end up having lifelong issues with anxiety and depression because it's a lot to deal with, especially in society with every image that you have as a woman is to be like hair-free and thin. Easy weight gain, tendency to easy weight gain, and I endorse that. My patients with PCOS will say, you know what, I'm exercising and I'm eating a healthy diet and I'm still gaining weight. And then you're over lifetime are at risk of things like cardiovascular disease. That's why it's important to have a conversation with a physician who understands the entirety of the spectrum of disease so that you can be proactive in your management of your PCO. You're at risk of developing diabetes. You're at risk of heart disease. You're at risk of high cholesterol. You need to have testing at baseline and understand what the trend is through your lifespan so that you can manage it. It's harder to change habits when you get old. So if you know it young and you have a proper diagnosis, then you can manage your entire lifespan, understanding what you're at risk of and having better outcomes, being healthy.
Okay, so it sounds like there's not a cure for PCOS by the sounds of it. So we're going to manage it, and if so, how are we managing PCOS?
Okay, so you want to, over your lifespan, sort of manage the periodicity of your periods. That's what we call them, periods, right? So you can do that with the birth control pill. That's one of the ways of managing it. But what you want to do is lifestyle things. So you think about eating healthfully, a low glycemic index diet, getting used to getting good sleep-wake patterns. Sleep deprivation also causes release of cortisol, makes you hang on to your weight. That is harder for you when you're already struggling with weight that comes on easily. You want to make sure that you're making right choices about exercise. You want to make sure that you're making choices about protecting the lining of your uterus. So when you're on the birth control pill, it just makes you get a period obligately. It's not making you ovulate, so it's not fixing your PCOS.
Right.
So you want to make sure that you protect the lining of your uterus, because if you don't have periods regularly, you're at risk of endometrial cancer. So that's a big take home.
Wow.
Okay? You have to understand the spectrum of disease and understand how to prevent it and keep yourself healthy in spite of it. You can live with PCO. It's not a death sentence.
We're going to end it on that note. You can live with it.
So interesting.
Wow. Dr. Dixon, thank you so much.
It's my pleasure.
Yeah, first time we've tackled this on the show. Fascinating. Why don't we take a break? A lot to digest there.
Yeah.
We're going to take a break. We'll be back right after this.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.